Hi, Dr. Andrea Maxim, naturopathic doctor and the creator of the Maxim movement. And as promised, I wanted to make a video specifically on treatment of autism because as you can see, it's not simple. There's no one quick fix because there's no one quick cause and effect for autism. It is such a multifactorial condition that environment, how the mom's health was, what they've been exposed to as an infant, what their diet was like, what sort of things were in their food as they were growing up, all play into weaknesses that over time can start to develop into the diagnosis of autism or some sort of a learning disability. So with regards to treatment, hypothyroidism, as I mentioned in that very first video, a lot of moms that are hypothyroid when they're pregnant can actually pass it on to the child. So getting the hypothyroidism screened for is very important. And then zinc, selenium, of course thyroid herbs, or maybe even medication needs to be involved here, like desiccated thyroid. And definitely don't forget about the adrenals. So we talk about the adrenals and stressors with adults, no problem. Every single person that walks in my office, including myself, needs to have some sort of adrenal support, but these kids do as well because their body is going through a lot of upset, and you can find if you test in them that their stress levels are much higher than I've ever seen in any adult. So this is something you don't want to forget about. Vitamin D, huge. I mean, especially in North America, we're so deficient in vitamin D naturally. Vitamin D is phenomenal for the immune system, for gut healing, all of those wonderful things that a growing body needs. Choline. Now, women that take choline during pregnancy are significantly lowering their risk of having a child with some sort of a neurological or brain deficit, but definitely you can treat the child later on if there's any sort of genetic abnormalities. And we talked about that in the first test as well, or in the first video, as well as in the second one about the MTHFR gene. So if you missed that, go back and watch those videos. DHEA, a huge component of fish oil, which lends to healthy neurological function because it's this beautiful source of fat that gets right into the nerves, right into the brain, and helps it heal. And we all know that fish oil is also a wonderful anti-inflammatory, so using it as such, because a lot of these things are also going to help with inflammation, and a lot of the triggers are usually pro-inflammatory. Probiotics, obviously. So we want to make sure that we're getting probiotics into children regardless as early as possible. Saccharomyces boulardii is a wonderful one. The multi-strains, so the lactobacillus, the bifidobacteria, all of those are phenomenal for these kids. As I mentioned, Candida overgrowth is a huge trigger to causing some of these symptoms or making them worse. So you want to be using some antifungal herbs. And don't forget that Candida likes to grow these biofilms around themselves. So you have to use enzymes like nattozymes or something like that to break that down. And definitely, of course, probiotics here as well. The diet is going to be the hardest part for most parents because it's really easy to put them or give them supplements. But if we're continuously exposing them to triggers that are making things worse, we're really not going to get where we want to go. We're just going to be kind of running around and chasing our tail. So the diet is incredibly strict, and it all depends on where your child is at, but it is recommended to go gluten-free, casein-free, soy-free, pesticide-free, maybe even look at a GAPS or a FODMAPs diet, and definitely an anti-Candida diet if necessary. So it's going to be a shift, but this is your child you're talking about, and you should be willing to make those changes if your child is showing any signs or symptoms of autism, ADHD, learning disabilities, so on and so forth. Antioxidants, huge, because the oxidative stress in these kids is also very big, and especially if they're not able to detoxify well, they're just going to accumulate all of these free radicals and stressors, and it's just going to cause more problems for you. Vitamin C, vitamin E, glutathione. You can actually measure your glutathione stores or how well it's functioning through a blood test, a very simple blood test. So I recommend everyone, age regardless, to get that checked. NAC, N-acetylcysteine, which is also a really nice precursor to glutathione. And then, of course, our friend curcumin or turmeric, which is a beautiful antioxidant and a wonderful anti-inflammatory herb as well. And then going back to, and finally, the MTHFR gene really needs support from B12, 5-methyl tetrahydrofolate, not just regular old folic acid, choline, vitamin B6, magnesium. Now, as I've gone through this, even I'm exhausted. There's a huge list of things for parents to start taking and giving their children, and I totally understand that. So that's why watching my second video on things you want to rule out, rule in, and doing the proper testing is incredibly important. So we can identify what of these things is of the utmost importance to start giving your child. So definitely don't skimp out on the testing because it is so valuable. Questions, concerns, comments, I'm always loving hearing from you, so definitely comment them below if you're watching this on the YouTube channel. Obviously, subscribe to the YouTube channel to watch more of these videos, or you can definitely email me directly on my website, www.themaximmovement.com. As always, I hope you have a happy and healthy day, and don't forget, I'm Dr. Andrea Maxim, naturopathic doctor and the creator of the Maxim movement, and I'll see you next time.